Hello, everyone. Welcome back for a brief deep dive into various contraceptive methods. You can see here the variety of contraceptive methods that are available to you and your loved ones. And we will go over each of them briefly, some of the major things to know about them, and we'll finish by looking at their individual efficacy levels. First, we're going to look at permanent methods, or more commonly known as tubal ligation or tube tying for women, and vasectomy for men. These are both considered permanent methods. I put permanent in quotes though, because folks will say, well, I know someone who had a vasectomy and had it reversed. And yes, this is true. They often, though not always, can be reversed, but without any additional intervention, they are considered permanent methods of birth control. Tubal ligation involves closing, blocking, tying, or removing the fallopian tubes. These are the tubes where the egg travels after it's released from the ovaries and where it typically meets the sperm before implanting in the uterus. So, if these are closed, blocked, or removed, eggs can no longer travel through the fallopian tubes to meet sperm. Vasectomies are similar procedures done for males. This involves blocking or cutting of the vas deferens. These are tubes that transmit sperm into semen. So, therefore, sperm can no longer make its way into semen. The important thing to know about these is that they are not considered effective until 2 months after procedure. So, they recommend an additional form of birth control for 3 months. IUDs, or intrauterine devices, are another method of contraception that are considered long lasting and highly effective. There are two major forms of IUDs, the hormonal and the non hormonal, or the copper. And the way that these work is they're small um, contraptions that are inserted into the uterus by a medical professional. And the hormonal IUDs emit a low level of local hormone that make it difficult for an egg, a fertilized egg, to implant in the uterus. Similarly, with the copper, copper is inhospitable to sperm and makes it difficult for an egg to implant in the uterus. The nice thing about IUDs is that they are long lasting and can be kept in place for 3 to 10 years, depending on the type. Again, there are pros and cons of all methods, so chat with your medical provider before considering one of these methods for yourself. Moving forward, I'll let you watch that video yourself if you'd like to, outside of lecture. Hormonal methods. Hormonal methods are a big, broad category that include everything from the pill, the patch, the ring, the implant, the shot, and, as I mentioned, some forms of IUD. Hormonal contraceptives deliver either the hormones estrogen and progestin in combination pills, or progestin only. These are sometimes referred to as mini pills. And these hormones work in a way to make it so that you don't ovulate. You don't release an egg each month, or an individual does not ovulate and release an egg each month. And thus, pregnancy cannot occur. With perfect use, hormonal methods of contraceptive are considered to be 93 to 99% effective. So they're highly effective. However, that is with perfect use. That means taking the pill the same time every day, not skipping, replacing the patch or the ring as directed by the manufacturer's guide, getting the implant or the shot as frequently as is recommended. So, if all of those things are followed, they're very effective. An important thing to know is that certain herbs and medications, particularly things like certain types of antibiotics, can interfere with hormonal birth control and temporarily lower their efficacy. So, if you are using, or you know someone who is using a hormonal method of birth control and you or they have to take antibiotics, definitely check with your medical provider to see if there's an interaction. A couple things to know is that smoking while using hormonal birth control that includes estrogen does increase the risk of some cardiovascular complications, things like stroke or heart attack, and combination pills in general that include both progestin and estrogen can potentially increase the risk of blood clot, stroke, heart attack, some cancers. Again, these are just important caveats to know. These findings are not true of the mini pill or progestin only. So while these side effects are rare, it's important to discuss them with your provider before using them, and also know if you have a personal or family history of any of these things. And a very important method to know about hormonal contraceptives and IUDs and permanent methods like tube tying or vasectomies is that they don't protect against STIs. The only form of contraception that protects against STIs is the barrier methods, condoms. Condoms are the only known form of contraception that protect against sexually transmitted infections. And again, those protect against most, but not all sexually transmitted infections. Those that are spread via skin to skin contact can still be spread by the skin touching another skin, even if a condom is there, but not covering the area of infection. So that's just an important thing to know. Barrier methods work by creating a literal barrier between the sperm and the egg. These include things like condom, external condom, internal condom, sometimes referred to as female condom. This is a latex condom that goes inside the vagina, spermicide, diaphragm, or cervical cap. Spermicide is a gel that kills off sperm. Diaphragm and cervical caps are both inserted into the vagina to block the cervix. You see the little asterisk next to all of these? These are intended to be used together, either the diaphragm and spermicide or cervical cap and spermicide, as they're not very effective on their own. And even when used correctly, as a whole, barrier methods are anywhere from 71 to 87% effective. So, a little bit less so than our longer term methods, our permanent methods, or our hormonal contraceptives, but they're short term. You use them when you need them, and they don't have any long lasting impact on the body. There is a quick video here if you'd like to watch it on your own on how to correctly put on a condom. I will not have you watch it during the video. Other methods, other things to consider that are forms of contraception. Fertility awareness or rhythm method. This is a method of tracking the menstrual cycle using a variety of features such as basal body temperature in the morning, cervical mucus, and the calendar, and avoiding sex on fertile days. This is considered to be 77 to 98% effective, depending on the method and the regularity of cycle. So, this is only considered appropriate for someone who has a very regular cycle, who's very in tune with their cycle, and is able to track it for a long time. This is typically not recommended for younger people, teens, people whose cycles are irregular, folks who have been having their cycle for as long, because it's harder to predict when ovulation is going to occur. The withdrawal or pull-out method is exactly as it sounds. It involves pulling the penis out of the vagina before ejaculation occurs, and this is roughly 78% effective in practice. So when done perfectly, the efficacy rate is actually higher, but of course, in practice, it's not always done perfectly. So overall, 78% effective. Emergency contraceptive, also referred to as the morning after pill or Plan B, these are pills containing a hormone known as levonorgestrel or ulipristal to delay ovulation. So these, if you have sex and ovulation is impending, these will delay ovulation, making it less likely that sperm will meet any soon to be ovulated egg. These are definitely most effective within 3 days of unprotected sex, but they can be taken up to 5 days after and still be potentially effective. And similar to our hormonal contraceptives, some herbs and medications, such as antibiotics, will affect their efficacy. Lastly, abstinence. Abstinence is a consideration. Completely avoiding penile vaginal intercourse is, of course, a method of preventing pregnancy if that feels most appropriate and useful for you at any given time. And lastly, this slide is a really useful chart from the CDC looking at contraceptive methods in order from their most effective to their least effective. So you can see the most effective are these longer lasting ones that are typically done or put in place by a medical provider and don't involve any human user error. So the long lasting ones like vasectomy and tubal ligation, the IUD and the implant are all considered most effective. So less than one pregnancy per 100 women per year, 99% effective. Then we have our other hormonal contraceptive methods, the injection, the pill, the patch, the ring, and their efficacy increases with perfect use. And then less effective, but again, still useful, would be our barrier methods or other tracking methods or alternative methods. So things like various types of condoms, spermicide, diaphragm, fertility awareness or tracking methods, and withdrawal. So the method of contraception that you use if and when you are sexually active is up to you and your partner or partners. Figure out which methods work best for you, consult with your healthcare provider. This just gives you some insight into the various methods and their various implications for health and well being and preventing potential unwanted pregnancy. That's all for now. Bye bye.